Welcome to Lunchtime with the Masters, brought to you by Pica. I'm Brett Robotsky, and today we have the honor of Dr. Louis DeCaro here today. Louis is the president of the American College of Foot and Ankle Pediatrics. He's from Northampton, Massachusetts. He's the new pediatric guru in our profession. So I thought I'd start off by asking you, the most biggest one is, what do we need to know about pediatric flat feet? In young kids, 3 and 4 year olds, do they, what do we need to, when do we treat it? When don't we treat it? Do they outgrow it?
Well, flat feet is at the top of the list with regards to pediatrics, unquestionably. Everyone wants to know, are flat feet normal? Are they abnormal? Are the pediatricians correct in ignoring flat feet? The general rule is this. At age 3 or 4, you should have flat feet. That's normal. There are egregious amounts of flat feet. And then there are normal amounts of flat feet. But after the
medial malleolus touches the floor, it's bad.
Yeah, I mean, that's,
okay.
I have 3 criteria for evaluating whether a flat foot is treatable under the age of 3.
Okay.
1 is it egregiously flat? 2, is there a genetic predisposition? Genetics play a huge role in this. And then 3rd is the child inhibited by it? Not necessarily have pain, but does the child want to be picked up all the time? Does the child suffer from being slower than his peers? After the age of 4 years old, a flat foot is not normal. And people say to me, well, I have had flat feet and I never had a foot problem, and they're adults. And I say right back at them, well, there are other pieces of your body besides your feet. Did you have knee pain? Did you have hip pain? Oh yeah, I had all those. I had knee replacements. And so a flat foot after the age of 4 will cause an orthopedic problem sometime in life.
So how do we identify when to treat, how to treat, what modality to treat it with?
Well, I'm big into orthotics. I'm very conservative. Certainly we'll go surgically occasionally, but I find that orthotics do a lot of the job. In fact, as you know, I see almost all kids, and a lot of these kids come in with AFOs and SMOs, and they're actually overtreated because the orthotic that's made is inadequate, and that's a really important factor. You can do a lot with orthotics.
Orthotics only going to last a short amount of time in these kids. I assume, what, it's every 4 to 6 month rotation that they need a new one. Prefabs versus custom in this space, I assume we're talking custom.
Well, under the age of 10, you can get away with a lot in the prefab category because the foot is not as complicated, if you will, as over the age of 10. The forefoot still really doesn't need to be controlled, and really what you're doing is trying to capture the heel, capture the valgus, and bring the foot into a more neutral position. So you can get away with a lower cost prefabricated orthotic in many kids under the age of 10 and some over the age of 10.
I guess the other big thing we'd have to hit in kids is growing pains. I mean, my older patients down in Boca Raton tell me about their grandkids who have these pains, and their pediatricians call them growing pains. Has that changed since I went to school? I'm sure there's new stuff out there.
So growing pains is a term that's like my kryptonite. It makes me shrivel up because I'm not a believer in the term growing pains. I think growing pains is an excuse for not knowing mechanically what's happening to a child. And these growing pains, these knee pains, these shin splints, these leg pains, these happen because kids have asymmetries, kids have poor biomechanics, kids suffer from poor gait, and that translates into these pains that they have, which may not be in the foot, but somewhere else in the body.
Interesting. So when the kid's saying something, pay attention.
Absolutely.
Well, with that, I think Louis has really given us some great tips. Please go to the forum at podiatricsuccess.com and give your opinion. Tell me what you think. Louis, thank you so much for playing with us today.
Thank you.
Thank you.